This one's a median nerve glide. So the nerves can get decreased mobility, and we can do certain exercises to help improve the mobility there. So for nerve-related symptoms, I like these glides. I'll demonstrate in sitting and lying down here. I prefer lying down or sitting with some sort of support for the exercise for most people, but of course for the video it's easier to see. So the tense position for the median nerve is going to be with that arm out to the side, kind of back behind you to some degree, elbows straight, arms kind of turned out so the palm faces forward and a little up to the ceiling, and then that wrist and fingers back. You can also take the shoulder blade and shrug it down, and you can turn the head and tip it away. So when you get in this max tension position, you may feel some sort of symptom radiating anywhere along the course of that nerve. So it could be neck all the way down to fingers here. Tends to be on the front side of the arm in general, because that's where the median nerve runs. So to do a nerve glide, we tug on the nerve from one side of the nerve, and then we can tug on the nerve from the other side of the nerve. So we take tension on one side, tension on the other side, we'll release. I tend to do this in multiple ways, so I will tighten up at the wrist and release at the wrist, holding a couple seconds each time. I'll keep the wrist tight, move the elbow back and forth to tighten and loosen. I'll keep the elbow straight, move the arm back and forth to tighten and loosen. Keep the arm straight, tug the shoulder blade down and back up, down and back up. And then I'll keep this all steady, and I'll turn the head and tip. Turn the head and tip. So in lying down, you might have support under your arm so that you don't fatigue, because you can imagine with that arm out to the side, you might get tired quickly. And you just support that under something here, and then you do that same motion. Wrist back and forward. You can do elbow forward and back, arm forward and back. Tuck the shoulder blade down and turn the head. I tend to do each one of those movements individually, and your goal is to not flare up your symptoms long term, but you are going to feel them a bit when you're doing the exercise. So it's tight, and then when you release, it relaxes, the symptoms go away pretty quickly. If you start having that increase over the repetitions where it's taking longer and longer for it to calm down, you might be irritating the nerve more than we want to.